This is time for just a little updated disclaimer. This content that you see on my account is only and only meant to educate you guys awareness about various emotional conditions. A new research article that I read either about medications, mental health, emotional well-being, or just general things like emotional intelligence, parenting tips. So my name is Dr. Najman Riaz, and I am a board-certified psychiatrist. I am licensed to practice psychiatry in the state of New Jersey, but I am not your psychiatrist. I can neither diagnose you nor give you any psychiatric advice. I have my own very small virtual psychiatric practice, which I have catered especially to working women. I can only and only see people for psychiatric reasons who are residents of New Jersey. Why? Because I'm licensed to practice psychiatry only in the state of New Jersey. Besides a psychiatrist, I also am a certified empowerment coach. So a coach is something like a mentor. A coach does not do therapy, they cannot do counseling, and they definitely cannot do a psychiatric evaluation or prescribe any medications. No, I am an empowerment coach. So what I do is I usually empower folks. And how do I empower them? So I empower them by helping them find their own inner strengths, their own inner skills, and then utilize those strengths in order to overcome the challenges that they face in their lives. I do use my, experience of understanding the brain, the behaviors work, and the human mind thinks, and what we can do to change certain behaviors, what we can do to set up goals, how we can improve our self-esteem, our self-confidence, performance, our communication skills. All of those things I kind of do know from my experience, and of course by having that knowledge of that brain after having gone to med school and doing my training in psychiatry. So I do use that background or use some of those skills in helping you to set up those goals as your coach. You have to pay in order to get coaching sessions for me. I offer some packages. I'm working on creating some group coaching sessions where folks can apply, and then we can have some weekly Zoom calls and have what we call as a group coaching, because I do open the doors for some group coaching. I will definitely notify you guys. If I'm coaching you, I cannot be your psychiatrist. I cannot do your therapy. And if I am your psychiatrist or if I'm doing your therapy, then I do incorporate some skills of a life coaching, but I do not call those sessions as coaching sessions. Those are psychiatric sessions. Those are therapy sessions. It's a structured medical treatment, and that has to be done in a very private setting, in a private office setting, in a private virtual setting, in a very special form of electronic medical record. That's a separate patient-doctor relationship that I will be having with you if you're a resident of New Jersey and are getting psychiatric care or psychiatric treatment from me. If you think that, you want to come join my group coaching and you're my patient, then I'm sorry. You cannot do that. That is not legal. I cannot be your psychiatrist. If I'm your life coach, I cannot be your therapist. In that case, I will have to refer you to a different psychiatrist and to a different therapist. So I hope my disclaimer is pretty clear. And as far as the content that I put on my social media, it's all meant to raise awareness of our emotional and mental well-being. Hope this was clear as to what my role is, what my goal is, what I do. Keep giving me feedback. Take care.